what we're doing at Where There's a Will is we've identified that we have a gap with our positive education and adults. So we're teaching adults youth mental health first aid, and we're teaching all our kids POS Ed and visible wellbeing, but we've realised that there's teenagers that haven't had any training and haven't had the advantages. So what we're doing with teen mental health first aid is we're looking to educate young adults and adolescents on how they can recognise the signs that somebody might be going through a difficult time, how to help them, where to get help for them, and if they are in a crisis situation, that we don't do that on our own. And what we've found with kids is, with evidence-based research, that they are going to their friends rather than to a responsible adult to navigate a very serious condition sometimes. And we're just concerned that that can overwhelm a young person as well, and they can become ill themselves. So we just want to really destigmatise mental illness, to let kids know that mental illness is considered the same as a physical illness in terms of the medical community, and that to ask for help as early as possible gives them the best outcome. So that's the goal. We're doing year 8 and year 10 this year and next year, because we were doing just year 10, and the feedback from the kids was that they wish they'd had this knowledge earlier. So we're now doing year 8, and going forward it'll only be year 8, because we've recognised that year 9 can be a challenging year for adolescents, so to have those tools is an advantage for them. And what's really important is being a good friend is about putting the safety of your friend before even your friendship or the confidence that they have given you, because we celebrate friendship and friendship's very important, but we don't believe that you have the skills, or is it your job to be taking care of somebody's well-being. And as I say to all my adults that I train, you haven't the skills either. You know, we don't teach in mental health first aid how to be a counsellor or how to be a clinician. So we certainly wouldn't want an adolescent to be navigating that on their own either. So it's important that it's actually putting your friendship first, is asking for help as early as possible, because that will mean the best outcome for your friend.
On Monday, Wednesday and Thursday, Years 8 and 10 had the privilege of getting involved in the mental health first aid course. This course was split up into 3 separate 1-hour sessions that were run by Pip Baker. This mental health course is all about how you can recognise someone with a mental health problem, along with what you should do when you find someone that is struggling with an issue. This mental health course not only taught us what to do when there is an issue with mental health, but to appreciate the little things in our life and to look out for others in our school in order to flourish together.
Everyone has been affected by COVID-19. The reality is hitting us especially hard, and things are continuing to change. We've had to adapt our learning and our everyday lives. This is a tough time, so it is especially important that you look out for your mates. Be aware, take notice, and if they don't see themselves or are not behaving the way they normally do, just take the time to ask a simple question, are you okay? Sometimes it may start a difficult conversation, as you don't know what kind of help you may be able to offer.